So this evening we have an amazing speaker, Dr. Alvarez. She is the oldest of 10 siblings, something which has shaped the way she approaches every aspect of her working life. She was born in Puerto Rico. She completed medical school with honors, becoming a member of the Alpha Omega Alpha Honor Medical Society, Gamma chapter. Her membership of such a prestigious professional medical organization was recognized for her continued excellence in scholarships and her demonstration of the highest deals in the profession of medicine. It's a passion of hers, and she just holds that still today. She's written a book, Heels and Ties, and we're going to give one of these away tonight. So you put your name on your ticket, and we'll be giving one of those away. She is the founder of Tri-County Heart Institute. She lives and practices with the philosophy of treating her patients the way she would treat her own family. I'm very proud that she is my cardiologist as well. Please welcome Dr. Alvarez.
Good evening, everyone. Good evening. And Happy New Year. I hope, Carl, can you hear well there? For the ones that didn't want to come out on a cold and rainy day in Florida, they're home watching this program. Okay, so it's a pleasure to be here. And every time Mary invited me to come and give a talk to you guys, always excited about the fact that we have people that are very mindful and interested about their wellness, you know? And I think that before I start going on my topic, because as Mary said, you know, I'm a cardiologist, and as you probably know, and if you don't know, then you consider yourself informed today, heart disease is the #1 killer in America for men and women. So irrespective of how young or how old we are, that's always going to be our life threat. Okay, so essentially, I wanted to start saying that heart disease is always going to be present in our lives. And I know that 80% of the time we know that it's preventable. But unless you know what things to do to prevent it, you probably will become one of those statistics. And unfortunately, in our community, in our country, preventive medicine is not upfront. You know, we practice a reactive medicine. And as a cardiologist, you know, after I went through my training in the detection and management of cardiovascular diseases, with a very particular passion about heart disease in women, because for many decades, women have been neglected, and it's very different, the presentation of heart disease in women and men, creating that awareness, making our women be aware of how do we present different and what needs to be done. But as part of that is also, once I learned the disease, then my job, my mission in this world is to help you prevent it. So as I understand the disease, then I'm here to help you prevent it. And again, having in mind with the idea that at the end of the conference today, I feel that it's important to talk a little bit about the disease to understand how to prevent it, because although people like you guys in this group are working on a continuous day to day, are working on being mindful or aware of the importance of making the right choices to maintain a healthy heart. There's some things that you can do better, and there's some things that perhaps you don't have control over, but unless you know, you don't know. Okay, so at the end of the talk, I want to make sure that you all know that it doesn't matter how hard we try, you always need to know, and you know when you get checked. Okay, so talking about that, I'm gonna, at the beginning, the introduction is, I need to talk about the disease so you guys understand how to prevent it. So bear with me for a few minutes, as I mentioned. I'll say, I guess we're gonna need to move this one. So we're gonna start talking about what the #1 cause of death in America is heart disease, and the most common cause of heart disease is coronary artery disease. And when we talk about coronary artery disease, we mean heart attacks. And there is different mechanisms for heart attacks. Heart attacks basically happen because mostly in men, so this part that I'm going to talk applies to the entire community, man and woman, but mostly in men, we see plaque formation. And believe it or not, plaque or atherosclerosis start building up in our body at the age of 4, when we are 4 years old and older. And the way we know that is because autopsies were done on kids in the Vietnam War. And when they look at their aorta, they already have the streaks of cholesterol, the fatty infiltrates in the vessels. So even though we are working very hard to be proactive, if we're not mindful that that is a condition that starts early in life, then it makes it a little bit challenging. So this okay, so there are two basic types of heart attack, and I'm going to go very quickly through this because the only reason why I wanted to present that there's two types of heart attack is because number one, the first type is when the plaque rupture inside your vessels. Basically, a heart attack happens because that plaque that builds up in your arteries slowly inside those vessels that perfuse your heart, if they break, it's like you cutting your skin. So whenever you have an injury, your body will try to create a clot. You bleed, and at some point, the bleeding has to stop. So it's your body with the mechanism starting working on stopping that clot formation. So that happens anywhere in your body. It's not just in our skin or the visible things that we see. So if that plaque rupture and the plaque causes injury, there is a clot that forms. The body doesn't know where that clot is forming, and now all of a sudden there's no flow to the heart. So that's a heart attack. People that have that type of heart attack, when the plaque rupture and occlude the vessel, those are the ones that have very, very strong symptoms, like the chest discomfort. I feel that there's an elephant sitting on my chest. My jaw hurt. I don't feel good. And they called the ambulance and ended up going to the hospital. Those people tend to do better because it's obvious that something is wrong in the heart, and they go and see medical attention. They get attention fast. So normally we tend to be able to protect and rescue a lot of heart from damaging itself. The second type of heart attack is the one that happens as the plaque grows slowly and slowly and slowly inside the vessels until at some point there's not enough flow going through it. So the best analogy for that will be if you have a 3-way lane on the highway and all of a sudden you have 2 lanes that close and now you have only 1 lane open. Well, the traffic still goes, but if you try to get to I-4 at 4 o'clock or 5 p.m. with 1 lane open, you know how that backflow and the flow doesn't go and it doesn't go? So what happened is that if you have that plaque building up slowly in your arteries, you might not even notice that there is a problem until at some point something triggers the increased demand. Your heart needs more blood flow, and all of a sudden there's a blockage, so the cars cannot go through it, so the blood cannot go through it. It can be physical stress or it can be emotional stress. And it can be the good stress, including exercise, or it can be the bad stress when something is bothering you emotionally. Now, the reason why I like to talk about this is because type 2 MI are more common, and the reason is because it's so subtle that people don't notice that they're having symptoms. So if you have, and we're gonna go over that, if you have any symptoms that makes you feel that something is not right. Mary and I were just talking today, and I said, when we're talking about cardiac problems, sometimes it's easy to, can you guys still hear me?
Yes.
Sometimes it's easy when it's obvious. And particularly for women, it's never obvious. Very seldom is gonna be obvious. So if you don't know what to look for, you might end up being victim of part of the statistics, and that's why I'm here today. So when you have type 2 heart attacks, because that plaque is building up for a while, your body adapts to that, you're an athlete, you're exercising, you're doing your thing, and you feel good, and then until suddenly one day you're not going to feel good. But then what can you do to not end up in there is what do you do to investigate how are you doing? So we can be eating healthy, we can be exercising, we can be doing anything that you want, that you think is good to preserve your health, but unless you get checked, you are not going to know. one, because I think I already mentioned all that. Also, keep going. Keep going. Okay, so as many as have an all heart attack go unrecognized, and their long-term consequences are very serious. So there's no such a thing as a small heart attack, a little heart attack. You have a little heart attack. No, there's no such a thing. It's either you had or you didn't have. There was an injury to your heart, or there was not an injury to your heart. I think it's not that, most people don't recognize that they could be having heart symptoms because they don't know what to look for. But sometimes, more often than not, we try to look for explanation to why we feel the way we feel, even though we don't necessarily understand that, but we don't want to think about the worst. We don't want to think about being sick, no? And although those type of heart attack are called silent because those are not obvious, I don't think they're silent. I think that the more we understand the mechanism is that people don't recognize their symptoms. So it seems silent, but it's not. And as I go through, the reason why I mention this is because what we know about heart disease, management, treatment, diagnosis, prevention, medication, everything was done in men. So what you read in books about how a patient with a heart attack will present, if you're waiting for that, then you better be a man. Because normally all those, that's why I present, no, the prior one. You got too excited. No, I just put my hand down. So, as I mentioned the silent ischemia, the silent heart attack, I wanted to bring this up because as we are in this journey, trying to enjoy our life, you know, we work very hard to be here one day, to be retired, to be able to enjoy our life, and then once you retire, move to a community like this, a vibrant community like the Villages, what we all want is to live a good, healthy life. That's what we want. But in order for us to get there, number one, you need to know, are you okay? And you won't know unless you check. And second is you need to know what is it that I need to look for. So if I'm talking about silent ischemia, then I have to talk about the atypical symptoms of heart disease. And that goes to everybody, but mostly women. And the reason why I scratched atypical in this slide is because there's nothing atypical about those symptoms, except for the fact that when they went through the list of, let's put a list of the most common signs, symptoms of heart disease, they went through how women and men present when they have a heart problem. But for a woman, the most common presentation is gonna be, I'm short of breath. If you notice that you're getting short of breath, then that can be a sign that your heart is in the three-way lane, went into one lane. And it can be that only warning that your heart is gonna send you before ended up injuring itself. And then shortness of breath, abdominal pain, mostly in the epigastrium, more like and right in the upper abdomen, pain in between the shoulder blades, fatigue is a very vague symptom. Now I feel kind of like tired. And tired, it can be a lot of things. And then we tend to blame it into, oh, this is because I'm taking care of my spouse, or, you know, I gain weight. And we tend to diagnose ourselves with everything but thinking, what is the worst that can be happening to my body? Nausea and the lower chest discomfort, which is what I mentioned in this epigastric region. So there is a condition that was finally described in 2012. It's called MINOCA, which is myocardial ischemia with non-obstructive coronary artery disease. So that condition is actually a condition where a woman presents with a heart attack back before 2012, before it was actually, I think that the beauty of having it described is the fact that we have an opportunity to identify that there's different mechanisms for attacking women, so we can get treated properly. So before that, if you were to present to the doctor or hospital with the symptoms that suggest that your heart was causing them, and you go for a test and you ended up having a heart cath, and they more often they're gonna find a clean coronary artery. So you might have a little plaque, but nothing significant, or a completely clean angiogram, which is when we look at those arteries and looking for blockages. And then we were diagnosed with, this is not your heart. this was not a heart event. Your coronaries look okay. But now we understand that our mechanisms are different, and this is what I want to emphasize today. There's one slide. Blockage or no blockage, you gotta take heart disease seriously. So the different heart attacks, different findings. In the left, I show plaque. I already told you how that happened. Either you the plaque rupture, or you have an increase in the size of the plaque. But for women, more typically, we're gonna present with other problems. It's gonna be vasospastic, which is spasm. So if the spasm is not happening when they're looking for it, they're not gonna know that you're having a spastic disease. And more often than not, when we see those individuals, is because they're going through a very stressful situation, and the arteries are responding to things that are happening in the body, including the secretion of hormones. And it makes those arteries squeeze hard, which transiently occlude the flow to the heart, which transiently will cause damage, which ended up being a heart attack. So when we think about the mechanism of we all, if you haven't, you probably have a friend that knows somebody that find out that a family member died suddenly, and they ended up in the hospital with a heart attack. And normally it's what we call Takotsubo syndrome. It's just the sadness and the stress was so strong that the arteries started squeezing and caused a heart attack, but not because they have blockages, but because they were causing spasm. Now those have a very particular appearance when we see them. The very tricky one is this one, is the coronary microcirculation. So in women, it's more common, although this is seen in men, it's more commonly seen in women. In women, it's more common that the condition that causes the heart problem is because the small vessels are dysfunctional. And that has to do mostly because of our changes in hormones. So now if we visualize the heart and we visualize how the blood flow gets to the heart, the blood flow gets to the heart is like a tree. There's a trunk, there's branches, and there are branches out of the branches of the branches, and then there's tiny branches that we don't get to see. And the microvasculature, which is those small vessels that are coming out of the big arteries, are the ones that are dysfunctional. So if you don't know that, and your doctor don't know that, you might end up being part of the statistics of the people that die or ended up with an injured heart, with a congestive heart failure or a heart that doesn't work properly because they were not able to diagnose that. So the mechanism is different. So we have about 450,000 women that die from heart disease every year in America. 50,000 more women than men die in America because they're not recognized. So when we do surveys, although we have improved dramatically over the years, it's still less than 50% of the women that know that heart disease is their number one health threat. If you ask them, they worry more about cancer. They worry more about any type of cancer, particularly breast cancer. For every woman that died from cancer, 6 died from heart disease. 64% of the women that had the heart attack didn't have symptoms before they had the heart attack. So that tells you why heart disease is so complex. And the question is, did they really didn't have symptoms? We always question that. Is it because they couldn't recognize the symptoms, that they didn't thought they had symptoms? And for a very long time, it was thought that it wasn't until 2013 that the American Heart Association finally released a statement recognizing that women have been undertreated, underrecognized, underdiagnosed. If a woman goes to the emergency room with a heart attack and a man is sitting next to their bed with a heart attack, the man has more chances of surviving because they're going to be treated faster because we know about their illness, but we don't know much about our illnesses. So it's a little more complicated unless you're lucky enough to have a provider that recognizes that, or you have the data to say, this is what I've been having, this is why I think it's my heart. So you either have to have a provider that is your advocate, or you have to be your own advocate. So the statistics are still scary. And forever it was thought that it was because we tend to put ourselves last. We tend to put our husbands first, our parents first, our kids first. No, I'm too busy, I cannot do this, I don't have time for this is gonna be a delay, I cannot. So then We were delaying our care, and at the end, the outcome is worse because we didn't seek attention on time. Then it was also because we were putting excuses to why we were feeling the way we were feeling. You know, more often than not, you know, we have our husbands who are strong men, but when they don't feel good, they don't hesitate to tell you. You know, I don't feel good, and sometimes more than others, but you know, they don't hesitate to tell you. They say, you know, I'm not feeling good. But we just go and not feeling good, and we can go for weeks not feeling good, and we don't say anything. But now we also understand that the reason why more women die than men every year from heart disease is because our own providers are not recognizing it. So if your doctor don't know, and you don't know, then good luck. Because if you're going to your doctor and he has no idea that your symptoms are different. And I actually, you know, I use an example. My mom is in Puerto Rico, and my mother has a very strong family history for heart disease. My grandma had a heart attack when she was in her 40s, and my mom has a sister that had a heart attack when she was in her 40s, had high blood pressure, high cholesterol. And I said, every time she goes to a primary doctor, she's sending me the labs. And I said, Mom, you need to do something about your labs. They're not looking good, and you need to make a difference. Oh, I'm working on my diet. Okay, you've been working on that for like a year and a half. It's not working, so something has to change. So when she goes to the primary doctor and said, you know what, my daughter thinks that I should do something different for my to improve my numbers. And he said, I don't know why she worries so much, because heart disease is not hereditary. And when I heard that, I almost have a heart attack because I said, wow, we definitely have a little work to do. Because if that is, luckily my mom has me as her advocate. But if you don't know and your doctor don't know, that's what I mean, that then this is the end of you. Because if you don't know what to recognize, and that was the intention of writing the book Kills versus Dies, it was that. It's like give you a powerful tool that you can say, okay, if I don't know, then who's gonna know? And then be your own advocate. And not necessarily to be, it's just to be smart when you go to your appointments, know what are the right questions to ask, particularly when we are into prevention. Because when you're thinking prevention, I want you to know that that doesn't exempt you from going through testing. Because even the healthiest of the athletes drop dead on races. Because plaque formation in your arteries is not just my diet. It's not just that I'm sedentary. There is genetic component. There is age is part of it. As we age, and I know that we hate that. We hate when people say, well, you know, at your age, why do you have to say my age? Well, because it's part of it. You know, as we age, there's things that are changing in our body that are making us be more prone to these conditions. And if you are proactive and if you have 10 things that are present and you can control 8, that is amazing. You know, that doesn't mean that you're destined to get there, but you need to know, you need to start with that preventive aspect of it. And I think that as we are willing to take our vitamins and invest on our care, invest on good food, which is amazing, invest on therapies, then we have to be willing to invest on prevention. I started saying our medical system doesn't focus on prevention. It's reactive. You gotta get sick in order to seek attention, no? I dream on a time in history that I don't think I'm gonna see. Hopefully my grandkids will see that. Where you go to the doctor to preserve your health. Where you go to make sure that you're okay. What do you find? What can I do? What else do I need to do? How my life look like? Instead of waiting until we don't feel good. Because health is a present. It was a gift. And we can do a lot of things to preserve that, but if you don't have the right information, nor do you have the right provider, then it's definitely gonna be a little more challenging. Not only is the system, including insurances, are not pro-prevention. You know, they don't even wanna pay for the pills anymore. You know, it used to be that they would pay for your MRI, for your CT scan. When you get sick, let me know. I'll pay for your studies. I'll pay for your medication that costs $600, but you gotta wait until you get sick. In the meantime, no testing for you. So
But even today, we know that the insurances are getting harder and harder. And now you're sick and you need a test and they don't want to cover either. So I'm not here pro prevention, no, I'm not here for disease either. So you gotta take a matter in your hands. And then you have to say, how much is my life worth it? And if this is gonna require for me to invest a few extra $100 to make sure that I know, then be willing to invest that, because you work very hard to get here. And then that's actually the message that I wanted to bring to you and everybody else. When you're in committees like this or groups like this, people look after you. What is it that you're doing? What is it that you guys are doing? You know, what is new? What can I do? And then you say, you know what? First start with knowing where you are. First start with, like I always tell all my clients that come for preventive care, I said, let's get a baseline. Where are we? And I wish that everybody that comes through those doors come because they want to know, what can I do to get better? Versus, I'm not feeling good. I'm still there for those, but I wish that I was there 2 years earlier, so I can take care of them. And so I said, it's time to get checked. You don't know until you know. I always say, you don't know until you know. Oh, but I've been feeling good. Nope, you don't know until you know. So you need to know. And what are those things that you need to know in order to know that you have a healthy heart? Well, at least your doctor should be looking at blood tests, making sure that what your cholesterol numbers are, inflammatory markers. There is a few substances that we can measure in your blood that give us an idea of your cardiac health. The stress test, very simple tool to get an idea of how is your heart functioning when you put extra stress on that heart. Also give us an idea of your exercise capacity if you're interested in exercising and you don't know, that's gonna be good for you, and how much is too much. Then an EKG, simple EKG, although the electrocardiograms are not necessarily very helpful tools to know everything about your heart, it can give us a glance of what had happened to your heart or what is happening at that moment. And I always, always, always advocate for calcium score. Calcium score is the simplest tool that we have to identify if you have beginning of hardening of the arteries. Very inexpensive, insurances don't cover it because it's prevented. Did that surprise you? $100 is average, $100, but it gives us a lot of information. Give us an idea of how much plaque do you have in your arteries, so we can be more proactive of what can we do to prevent that plaque from growing, like I explained to you, or rupturing. We can do so much to prevent, and I think that so many times we think about, but I don't want to take a pill. And I said, well, we don't have to take a pill. But if you don't identify on time, by the time you come, you might have to take a pill. So if we're working on prevention, then get the information, work and be proactive with that. The calcium score is an amazing tool. It will help your doctor guide your cholesterol therapy. I know that everybody wants to give you the statins, they want to give you the prescription, but you're like, do I really need it? What is my calcium score? Can we match it? What is the therapy that I can go through? Can I take omega-3? Can I do something more natural before I go through the route of medication? And then it also gives your provider an idea of what is your risk for heart attack or a stroke in the next 5 to 10 years. The reason why we mix heart attack and stroke is because the mechanisms are essentially the same. So in order to protect your cardiac health, you have to be your own advocate. So get talking, you gotta talk about it. You need to be familiar to what are your risk factors for heart disease, and don't delay your care, speak up. I always said, you have a provider that you mentioned to them that you don't feel good, that something is not right. Nobody knows your body better than you. Nobody knows your body better than you. So if you are saying something is not right, and they are not helping you and understand what's going on, and you don't get an answer, I always said, then you need to find another doctor. You need to seek another opinion, something is not right. Don't settle for that, because what if you are in front of somebody that cannot recognize those symptoms? Next one. Oh no, that's right. No. Prior, because you keep going forward. There. Okay, so I love this one because it's like, to prevent a heart attack, take one aspirin every day. Take it out for a run, then take it to the gym, then take it for a So if we move more, there is a lot of things that I'm gonna actually say, put the other one. I said, it's not that cardiac disease running your family, it's that nobody runs in your family. So, I'm going to, because for the sake of giving you the opportunity to ask questions, I know that you probably have a few questions about, preventive and what can we do and things like that. I'm gonna just open up for questions now. If you want me to talk about something else or elaborate on something else, I'd be happy to.
Is the calcium score that you're speaking of, is that through blood work?
No, a calcium score is a CT scan.
Oh,
It's a
okay.
CT scan of your heart, and it doesn't require IVs or nothing. It's just like a CAT scan, and the radiation that you receive with that CT calcium score, I'm sorry, because I didn't say CT calcium score. Yeah, the correct term is a CT calcium score. And the radiation is similar to mammogram. So it's a very minimal radiation, very valuable information, a lot of information for you and your doctor to be able to guide your therapy. If you have history of coronary artery disease already, this is mostly preventive. So if you already have history and you have had a heart cath, or you have stents, then you probably don't need a coronary calcium score, because we already looked at those arteries and we know how they look like. Although calcium score will be good to guide your treatment with cholesterol medication. You have a question?
Okay, I don't know. The calcium score, is there a score that is a generic, middle of the road number that we're looking for? Or is it very advanced and it's?
No, it's very generic. Meaning simple to understand what this score means?
Yeah.
Oh, very simple. 0 is what it should be. Because we're born with no calcium in our arteries, no? So calcium score 0 is how we're born. We don't have blood, we don't have calcium. The reason why we measure calcium is because calcium is bright in x-rays. That's why our bones show up on x-rays. So how does that serve as a surrogate for plaque? Because the longer the plaque has been building up on that artery, there's opportunity for the calcium to sit on that vessel, and then now we can see it. So it measures the plaque formation throughout your lifetime. Right? Did that answer your question? Okay, 0 is normal, anything below 100 is mild, anything above 300 is severe, so that means that you have a lot of calcification in your arteries, and then your doctor will be very aggressive with your numbers then.
I was told that there was something that women have that men don't have as a sign of something with the jaw or the tension. Does that ring a bell with you?
Well, more often than not, a woman is not going to come with jaw pain, but if they can present. They can present. No, actually, we always think about, when we present with typical symptoms, what we call typical. No, I'm getting this heavy feeling in my chest, my jaw is hurting me, my neck feels funny, my arm feels funny. We always think about heart. Nobody, you're not gonna go to ask and tell a doctor, my jaw is hurting. They will think about your heart. They might think about dentists too. I hope they think about your heart before you think about the dentist, because you're not gonna die from a toothache, but you might die from a heart attack, no? But those are typical symptoms of presentation, but it's not actually very particular a woman. It's not very particular one. For a woman, it's more like I explained. It's more, I'm tired, I'm short of breath. That's why you're gonna tend to be missed. Because it's like, if you go to the doctor and you say you're short of breath, they're gonna look at your weight and say, well, you gotta exercise a little more. You have to lose some weight. And you're like, okay, I know that, but that's not gonna kill me. So can we start with what can be my life-threatening problem, then move from there? But there's nothing very particular about jaw pain in women as it is jaw pain in general for heart attacks. Back there, madam.
I have a friend who just told this week that she has calcium in her heart, and that there's nothing they can do about that.
So they're probably referring to calcification of the arteries or the valves. So once you have that there, you can help reverse it a little bit. But once it's deposited, our goal should be, what can we do to prevent it from getting worse? There is a lot of things that can be done about that. They need to check the inflammation in the patient, because there is a marker for inflammation that promotes more plaque formation. They need to check lipoproteinate, because that's a particle that, I speak about that in my book. It's a particle that circulates in the bloodstream that behaves like the bad cholesterol. That one is more genetic. They can look at her cholesterol numbers, manage her blood pressure, and make sure that she's not taking a calcium supplement that deposit. Because that is very common, particularly in our community when we have so many people with osteopenia or osteoporosis and they're put on calcium supplementation. The majority of the over-the-counter calcium come from limestone, and that is the calcium that deposits. So it sits on the structures of your heart and your vessels. So if you are diagnosed with high calcium score, make sure that if you're taking calcium, you discuss with your doctor. I'll be happy to. It's called calcium hydroxyapatite. Is the one that you want, because that calcium is from shellfish, eggshells, bones, and doesn't deposit like the limestone do. You can have the one from bones. Yeah, because it's just different sources that will tell you from where they're coming. Yes, sir.
Yes, I know you can take a sonogram of the carotid arteries and see somewhat of blockage there. I heard there's a new device out that kind of replaces the stethoscope, which will allow the doctor to see directly blockages inside the heart without having to do a cath. Is that true?
Without having to do a cath, we don't have that yet.
Okay.
But we do have it's interesting because the stethoscope has been such a good tool for so long, but now we can actually, in addition to that, it's like an echo. It's like ultrasound of your heart. Rather than listening to your murmur, now I look what is causing your murmur right there
I
and
think
there.
that's what I'm thinking.
Yeah, so normally if you come to the doctor's office, it's a new technology, but if you come to the doctor's office and they listen to you hard and they find a murmur or something, a noise, they will want to do an echo. And then now what we're doing is that we'll actually, we can actually put the probe in there and then look rather than listening. But that's what it comes to substitute, but it doesn't substitute the heart cath. There's a hand in here.
I just know that being in the villages, for us, we've gone through several different doctors. It's just very hard to find a decent, regular doctor. So do you see people for other things or just the heart?
Even my patients ask me that question all the time. I said, no, I'm not a primary doctor, I'm a cardiologist. But you know what? That's why it's so important to keep demanding quality, because we all deserve that. We all deserve to have a provider that is there for us, that understands and that is present, that is orchestrating the care. I understand that in here is a big community, and in this community, what is going to work best is, which I'm pretty sure you will agree unless you have a different way, is word of mouth. Is who your neighbors are going, how do they feel that they are receiving the care in that place, and are they satisfied with that care, and what are their outcomes, and also your particular needs. For example, if you are somebody that are proactive and you're in prevention, then you want to find a doctor that fits you. Because when you start saying, oh, can we work an alternative rather than give you that pill, and that doctor is not that type of doctor, then it's going to be like, this is not a match for me, versus it's a match for somebody else. So luckily we live in an era that there is a lot of information in the internet, and then it can give you an idea of, and then you can also, in addition to word of mouth, it's like, there are places like WebMD and other places that you can get some information about the preparation. And also, in addition to that, you can actually request an interview to get an understanding of, can we meet, and then kind of like, this is what I'm looking for, this is what I need, and a provider, can you provide this for me? I think that the most important thing when it comes to your provider is somebody that you can talk to. Somebody that you feel that is your partner in your care.
One of the things I found is I had a bike accident riding a bike, okay, and I needed to, I was in Ocala Hospital, had to follow my doctor, but as soon as I heard it was an accident, nobody listened to me. Nobody.
That is the system.
Nobody. And I'm
Because
like,
we live in a litigious community. No community, country. Have you seen the billboard? Dan gave me $100,000. So whenever you live in a litigious community, that's what we ended up there. And unfortunately, that is a lot about what had happened in healthcare as well. Now you come with a headache, and even though your doctor thinks this is just a plain headache, they're gonna order MRI and CAT scan because God forbid, and then you're gonna sue me because I didn't find out that you have a sinus infection. So I'm sorry that you had to go through that. I know that it's bad when you go through a system that is like, no, sorry, we cannot provide care for you. Yes, sir.
Black buildup, you also mentioned cholesterol, is there correlation there, or how does the LDL come into play?
So we know that plaque buildup is more complex than just cholesterol. Cholesterol for a long time is being considered one of the most responsible causes for plaque formation, and now the more we understand, we know that it's not just cholesterol. So yes, it is part of it, but so if we think about risk factors for coronary artery disease, and cholesterol is one of them. There is 7, 8, cholesterol is one of them. That's why when we ended up diagnosing patients with normal cholesterol with hardening of the arteries or coronary artery disease, they're synonym. Well, why? My cholesterol is okay. Well, it's not just about the cholesterol. If it was that easy, then we'll have a lot of people that will never have heart problems, or we have a lot of people that will have heart problems, and then you find out that there's people who had cholesterol that never ended up having heart disease or heart attack because there is inflammation, there is genes, there is family history, there is smoking, there is diabetes, there is sedentary life, there is obesity, so there's a lot of other things. So the LDL is what we call the lousy cholesterol, the bad cholesterol. We know that is the particle that plays a significant role in plaque formation in men. In women, it's been identified that is the triglycerides and the LDL, not just the LDL. Triglycerides elevated in men doesn't cause plaque formation. Triglycerides elevated in women does cause plaque formation. So if you're thinking about traditional, and we think about LDL, your doctor is always going to be looking at after that LDL, but that's one thing. That's one aspect that they're going to be covering.
So at birth, our coronary calcium score is 0. So do you know statistically what is the average coronary calcium score for anyone, or men or women over the age of 50?
So we actually started looking into calcium score after the age of 45. That's actually when we started looking for it. So we know that because of the way we live and what is all the things that are happening in our body, that is expected to have a little bit of plaque formation. So less than 100 is considered acceptable. It's mild. This is part of your disease at the age of 65. Okay? So you're 65 or older and you have a score of 47. That's amazing. No? So if you ask me what is the percentage of patients that are 50 or older, 50 years old, what is expected for them? Well, we expect 0. But if you have anything that is below 100, we said it's manageable. It's still mild, and not only is mild, but we can do something to prevent it. Because if you're gonna live another 40 or 45 or 50 years, then we have a long way of risk factors that we want to address. If you come and your score is 47 and you're 50, we're like, it looks good, but let's make sure that these are the things we are actually putting into place, which is preventive care. Not necessarily treatment, but preventive care. So when you know that, give you a tool. Because it's not the same when you go 0 and when you go, your score is 110 and you're like, oh, I better do something. Then what is it that I need to do? Well, how can you help me with this? Particularly, what I like about this is because when we're talking about management of cardiovascular risk, which much of this is done by your primary care doctor before you ended up going and see a cardiologist. If you're not thinking about visiting your cardiologist for preventive care, if you're thinking about visiting the cardiologist, because I hear that a lot when people tell me, I don't have to see you, I don't have any heart problem. And I say, well, what about we prevent that? What about I'm here to prevent that? But when you look at numbers and your doctors are looking at your labs and they look at your cholesterol, and I'm going to use, for example, the LDL, they said, oh, it's okay. It's okay. It's okay. And then you're like, okay, for whom? Because if you have your calcium score, then my number should be this. Or if you have a high calcium score, now your LDL is 140, you're like, I don't think this number should be here. So can we do something? So that gives you power to be more proactive. with what do I need to do with my lifestyle. Perhaps it's changing my diet. Maybe I have to change the way I'm eating, reducing the inflammatory products, a lot of flour in my diet. I'm eating too much of the saturated fats, and then that will actually be proactive, so 30 years down the road, you don't end up with heart problem. Back there?
With a calcium score of 1100 and the person cannot take statins, what do you do?
Say that again. With a calcium score of 1100 and you already take statins.
Can't take
You
statins.
cannot take statins, okay.
It's a male.
So it's a male. Okay, so, well, if you cannot take statins and your calcium score is that elevated, then your doctor will have to work with you and alternative, which can be natural alternatives, or looking for other drugs that are not necessarily statins, like Zetia, for example, is an inhibitor of cholesterol. Omega-3, I will be on omega-3 and niacin, vitamins and fish oil, and then work on the inflammation. Look into other factors like lipoprotein A, like hsCRP, which is markers of inflammation, because it's not just the cholesterol. So now when they're putting you, when we recommend statins, and I say we because I belong to the community of cardiologists, but I try to avoid them if we can. But sometimes we have to recommend them. Statins help prevent plaque rupture, and they will, if we can prevent the plaque from forming, it will be ideal because then we don't have to use statins, but prevent the plaque rupture and stabilize the plaque. High calcium score doesn't necessarily mean that it's obstructed. It's just saying you have a lot of plaque. And you can have a lot of plaque, and the way I describe to my patients is, it's not the same when you unplug the pipes on your sink, and like you have a leak, and then you're putting everything out to look where that leak is, and you see all this black stuff inside. But the flow, the water was going, it wasn't obstructed. That you can have a very high calcium score, it's like a cast. The vessel is still open, but it forms like a cast. But the only way to know that is actually doing a physiologic test. So if somebody have a very high calcium score, we normally will recommend a stress test to make sure the blood flow is going through that artery. And if the blood flow is going, then let's focus on preventing that plaque from going. But yeah, it will have to be like a recipe. You guys have to sit together with your doctor and say, okay, what are the potential causes for this? And what can we do if we cannot take statins? If the LDL is very high, they might consider PCSK9 inhibitors, which are the injectable drugs. Repatha and Praluent are those. And basically what those drugs do is they enhance the receptor of bad cholesterol in your cells, so it makes your cells trap more cholesterol and put it inside the cells so it's not circulating in the bloodstream. So that's for patients that don't tolerate statins, or patients that are taking statins and the cholesterol is still not responding. Any other questions? Yes, sir.
You mentioned the fact that there's 450,000 women per year that die, 400,000 women. Why is it that there's more women that are dying? Is it because they're just not recognized?
That is correct. So you already heard the question? The question was why more women die from heart disease than men? And then the question is a combination of things. Number one is because they're not recognized properly, they're under-recognized and under-treated. So they're under-diagnosed, under-recognized, under-treated. So number one, that delays the care. So normally their outcomes are much worse. And it's known that our coronary system is a little different. We are different. For a very long time, it thought in history, and it's changing, thank God, that we were the same as you guys, just with different body parts. But then we said, no, we're not. The fact that we have 2 X's in every cell in our body, and every cell is responsive to hormones, then that makes it a completely different individual. Like, we are not just a man with little female parts. So for a long time, it was very hard to recognize that. And also because we wait too long, because the community don't know. If you knew, now that you're here, are you guys together? Now that you're here, let's say she was not here, and then she's home saying, I'm kind of like a little nauseous. I feel like I'm tired. And then she said that for 3 days in a row, you're like, do you know that can be your heart, because you heard that. But if we don't hear that, if we don't know, and you go to the doctor and they say, oh, you have virus, And then you ended up with a heart attack at home because then you start getting your heart get worse and worse. So then the idea of having this type of gatherings, of these talks, is like we create more awareness and more people know. And then we can save our wives, we can save our daughters, some of our mothers if they're still alive. We can save so many people, but we need to continue talking about it. It cannot stay here. Yes, sir.
Can you share with the group the percentage of the people that die? What percentage is actually preventable if they will receive treatment in time?
I already said it, 80%. 80% of the heart disease, heart disease and heart deaths are preventable. 80%. So the fact that we have a condition that killed the majority of the Americans, if you take what killed this person, heart disease, what killed this person, heart disease, and you said 80 out of 100 people could have been saved if we were doing something different from that. And it's all about prevention. It's all about prevention and recognition.
Up with diet, if you're a vegetarian or vegan, for vegetarians, is that so many people say you should go to that route in order to eat more healthy. Is that true, or is that just?
It helps a lot. And I said it helps a lot because when you are eliminating the saturated fats from your diet, saturated fats creates oxidation in the system. And oxidation is like rust. Like when something gets rusted and then it gets rough, and now the body's gonna try to heal that, so it's gonna put cholesterol layers in there to protect it. So whenever you have high inflammation with saturated fats, most of the saturated fats in our diets come from animals. So it's gonna be the meat, it's gonna be the cheese, it's gonna be the milk, no? But if you do have, there's a party coming, but if you do have, I'll finish with this one, baby. If you do have a more plant-based diet, ideally if you have a vegetarian, you can be a vegan, it will be much better because you're eliminating that aspect. However, being vegetarian doesn't mean that you're eating healthier than somebody that is not vegetarian. Because I had vegetarian, actually I did try for a year to be strictly vegetarian. And then I found myself eating more processed food than I ever ate in my life. Because now I'm eating these fake wings, these, the garden products and things like that. And I said, fried French fries, they are vegetarian, but they're not healthy. So then you gotta be mindful, I'm vegetarian and I'm eating healthy. So when it comes to, and then I ended up being pescatarian. So when it comes to your diet, the cleaner you eat, the better it's going to be. I do advise that you try to eat more plant-based diets. If you cannot be vegetarian or vegan, try to make sure that when you're having your animal products, you're going with lean meats, preferable white meat, fish if you can afford it, and then go chicken, turkey, and then down the road. So I mentioned the red meat always at the bottom, because this is the way our cows are treated and things like that, and the antibiotics, and there's so much more that goes in our food chain. That's what I said. If you can afford it, just try to focus more on your plants and your vegetables. But yes, it does work, and it actually, if you guys are familiar with Dr. Ornish, if you're not, he wrote a book called Undo It. And that is all about, they prove that the only diet that helped reverse some of the plaque that already built up in our bodies is the vegetarian diet. It's the only diet that's working.
But I would argue that was based on a grain-fed animal. That was not a naturally grass-fed animal that they're comparing. You can't compare that to a grain versus a grass-fed animal.
Well, I'm not sure that they actually did all meat, but it's very hard to find grass-fed food. It's hard. So, I don't know how, I know that it's not impossible. I know that it's possible, but I'm pretty sure that if you try to eat meat from grass-fed animals, you're gonna end up having days that you don't eat meat because you couldn't find it. So you're gonna be eating more of the vegetables. But yeah, so the idea is that we're thinking about what causes the plaque. Is like, try to avoid anything that causes oxidation in your body. Even, like now that you mentioned the grain, because wheat causes inflammation in our bodies. That's why pasta and flour and all that is actually as bad as, I'd rather have you eating a piece of steak than eating a bread every day, because it causes a lot of inflammation in your body. So if we think about what makes my body do this, it's like what is irritating your body, and then we gotta be mindful of that. Okay, one more question.
I had a doctor tell me that the body cannot heal without animal fat.
See a farmer?
His son is. Okay, I guess you need to change your doctor. So no comments on that, love.
I did have one back to the calcium, thank you. The calcium, my doctor had recommended 2 Tums a day for the calcium content, being a female and whatnot. And so I've taken 2, like for 20 years a day. I know that there's a calcium component to this. Should that be discontinued?
For you?
Yeah.
Well, how are you gonna substitute that? Do you need it?
I think it's a preventive. Take it so that we don't have, I get good bones so far, but he just recommended, I'm not the doctor, but now that I'm hearing calcium stories, is that recommended?
Well, I guess that it will be useful for you to know what is your calcium score. And if you already have the positive calcium, then you said, there's an argument. I'm not gonna take something that is deposited on my vessels.
1100, yeah.
Yeah, or your valves, because the valves are also a surrogate for that. So if you haven't had a calcium score, but your doctor told you that you have mild calcification of one of your valves, that is actually a marker of plaque formation as well. So I would say that, but if you really want to be very proactive, then I will eliminate it, unless I know that I'm taking the right calcium that is not going to cause problems down the road, because you're gonna live another 40, 50 years. Is that true?
Yeah, right.
Yes, sir.
How about, they used to be taking a small dose aspirin every day for your heart.
That's actually, I'm gonna finish with this one, I promise you. Okay, so that's actually is a very, very, very good question. It's very, I know that recently in the media, there was an article that came from a study that was done 3 years ago, but for whatever reason, they decided to publish it this time. And then it was more about prevention, aspirin, is it good, it's not good. So the simple answer to this is, if we know that aspirin, again, we go back to what we call, not to insult the male here, but male-centric medicine, where everything was tested on them, and now we say, well, if it works for them, then it should work for everybody. So for men, it prevents stroke. For them to use aspirin, 81 milligram. And then they assumed that for us was gonna be the same thing. So then now we discover that it doesn't help preventive for women, it's not good. We were using just for prevention. Clear. If you're using it strictly for prevention, then there's no proof that it works. Because they're thinking that it can cause more complications, bleeding, because we tend to have a lower body mass. It can become elevate our blood pressure, NSAIDs and stuff like that. So if you're already taking aspirin because your doctor recommends that you take it, then don't stop taking it. Talk to your doctor first and talk about why did you recommend that I take this? Because you might have a reason. For example, if your calcium score is elevated, you're gonna be advised that you take aspirin. Because I explained to you that plaque can rupture and form clots inside your vessels. So if you already have plaque in your arteries, your doctor might say, take a baby aspirin. Because if one of those plaque ruptured, you don't want a clot forming in there. So everybody is very different. But if we're thinking about just strictly for prevention, then women that don't have any history of heart disease or stroke shouldn't be taking aspirin. If you do have a condition that requires your aspirin, then you take aspirin. If the men are taking aspirin, they should be taking it because it helps them. It helps the men.
Did you say that cheese is bad? I love cheese, that's why.
And this is actually why I mentioned cheese, because when I measure levels of saturated fat in my patient's blood as part of the preventive program, I find a lot of high levels of saturated fat almost always, no? Only a few of them don't have high levels of saturated fat. So when we go through the list of the things that they need to cut back, I I used to start with red meat, and the majority of them tell me I don't eat red meat, or I eat red meat very seldom. But then I realized that the majority of the saturated fat is coming from their cheese. Because this community, this is what we tend to like. It's more cheese, not so much red meat. First of all, our body doesn't digest that very well, so we don't eat that much. The teeth are not that good anymore, so we cannot chew that much. So, but the cheese, we love the cheese, so yes. Excess is better. Well, they're vegetarian cheese. Do you know that? They're plant-based cheese. It tastes pretty good. But if you some of them, I agree with you. Let me just put that disclaimer. Some of them. I think that if you can, what is your name?
Nabil.
Nabil?
Yes.
Nabil?
Yeah. I'm your patient.
Nabil? You gotta tell me your last name.
Riyad.
Mr. Riyad. Okay, so if you are going to, because if you eat cheese, then I said, in order to make this something that is a habit that you can create that lasts, then don't just stop eating it. Just try to go down on your frequency or amount. So if you eat it every day, then try to do it every other day. Or have a day that you have it and then, so just like, and then go from there. I know that we all have to enjoy our lives. There is some, what we call guilty pleasures that we like, oh, but I like this. I said, it's okay, as long as this is not something that you're doing on a daily basis.
Is goat cheese okay?
It's still cheese. And it's not come from an animal. However, it tastes better.
Can you find out what cheeses are good?
What cheeses are good? Let's talk about cheeses then. Okay, so let's wrap this for tonight, and I'll be happy to have a chat with you as soon as we're done here. If there's anything else that was left unattended here. If you ever need anything from me, I want to let you know that my office is located in the Sharon Morse building, the 3rd floor. You don't need to meet a cardiologist. You can just stop by and say hello. If you have a question, you can email us, info@tcheart.com. And if there is anything that I want to ask you tonight, is that share this. Just share the knowledge, whatever little that you learned today, something that captured your attention, just share with your friends and your family. So the girls want to, Carl bought this book. This is my book, Heels versus Ties, Living with Your Number One Thread. I chose the title to create the big difference between heels, them, ties. No, heels, us, ties, them. We are different. And as the way that we dress and things like that, we are very different when it comes to our heart health. So Carl bought this book, and he wanted to give it to somebody here tonight. So if you already have my book and you win this, then you can do whatever you want with this. Maybe give it to your neighbor or somebody. So the girls had, you want me to do it? Okay, so let's see who's gonna be the one that is gonna be reading this book tonight. Cecile Dallas.
Oh, stop it right there.
She is the winner, Carl. Here we go. This is for you.
Yeah, that's right.
Now I'm gonna make a blush, and she's gonna say, why do you do that? And I get emotional every time. All the time. She saved the man that I was engaged to's life because he was being mistreated by not one cardiologist, but also his primary care doctor. They wrote him off as too fat, too old, too this, too that, and they didn't listen. The man had coronary artery disease. He had 2 open heart surgeries and 6 stents, 3 put in when I was with him. But he was dying. His heart rate was not even 20%. The hospital was shocked that I could get him there on my own volition without calling the ambulance. Thank God that she came in. We had a rough start, I will say that. There was a miscommunication.
Because of her.
Yeah, she heard it was me. There was a miscommunication. His cardiologist said to
to me, I put in the referral. The emergency room told us, which they're not supposed to do, that he needed a pacemaker that night. 11 days. I kept calling and calling and calling. I didn't know who the cardiologist was. They kept telling me, we send it. She finally was paged incessantly one night. She happened to be, when did you come in, 11 o'clock at night? She was doing rounds. She came in and she said, I sense some animosity.
Well, you gotta clarify that I wasn't the cardiologist that
She was not the-
seeing you for 11 days.
Right, no, she was not. It was him that never called her, okay? She came in, she asked this gentleman, can I sit next to you? She pulled the chair up and she held his hand. And she told him that he absolutely needed a pacemaker. And she put it in the next day. He lived. He's still alive despite the fact that he had acute COVID and was in the hospital for 4 months and a nursing home for 3. And now he lives permanently in a nursing home in New Jersey. She knew the stress I was under taking care of him, and she would say to me, what'd you say to me?
I don't remember you saying it.
Get rid of
So
him.
many things to
Get rid of him. She said, it is not healthy for you. She said, you're going to have a struggle.
I'm gonna clarify that. She's coming to the office and she's like, oh my God, this is too much for me. Oh my God, oh my God, oh my God, oh my God, oh my God. And I said, well, if you don't feel that you can manage this anymore, then we gotta do something about it. I never said get rid of him. Why would I put a pacemaker in him and I said get rid of him?
She told me his family has to step up. Well, his family could care less. They live in New Jersey, and one lives in Maine. So it got too much for me. And because she spoke at one of my meetings, Mary is now her patient.
And my calcium score is 0. Thank you so much, Dr. Alvarez, for coming this evening. Let's give Dr. Alvarez a big round of applause. Thank you all for coming out this evening in this horrible weather that we're having in Florida right now. It's pretty cold. Hey, I get my long johns out tomorrow.
You have to remember, she lived in Bermuda.
I can imagine our Facebook friends somewhere, I don't know where up north, saying horrible weather in Florida.
Thank you.
Felt like north.
She will be back.